Dr. Rick Sanok. I direct the mental health program at the Traverse Health Clinic. We provide counseling services for individuals that have moderate and mild mental health problems. Community mental health serves those with much more severe problems, but we have a very large population that we serve. This year, with the $9,000 that we received from United Way, we were able to fund a position for a social worker part-time who is able to implement a brand new program that has really done well. We screen every individual that comes into the clinic for mental health issues like depression and anxiety and stress, problems on their jobs, problems with unemployment, and we're able to do that right up front at the time that they first walk into our clinic as a new patient. This really helps, because not only do they have their physical health care assessed, all their other types of problems like diabetes or heart problems or the other issues that they have, but at the same time can look carefully at their mental health issues, their stresses, their problems in their lives. We've screened 380 people this year that have walked in the door that would not have been screened otherwise. And we've been able to follow that up with an action-oriented, solution-focused, resource-driven type of program that allows them to connect with the types of things that can really help them in their lives. Other agencies that can help, other providers. We've had them look at their own strengths and assets and really examine how they can help themselves in dealing with both their physical health needs and their mental health, stress-related issues. The other thing that's really come out of this is we've integrated fully with the medical providers, the healthcare providers. So now we have a comprehensive system where we talk face-to-face with people that are working as professionals on healthcare issues, the mental health, the stress-related anxieties and depression. It's now an integrated system that we can work together. And this helps in a lot of ways. It reduces people being admitted to emergency rooms. It reduces the crises we have in our community. It allows people to solve their problems before they become big issues. It takes the burden off our major agencies. And all of them are really excited about this. We meet together every month and a half and we talk about this being a really important part of the continuum. So that's been great. I have one great story. There's a man who was struggling a lot with unemployment. He was struggling a lot with some physical issues. A young man who had been fully employed previously, had never run into stresses like this before. And he was really stumped on where to go, what to do, how to pull his life together. In counseling, found out he was an artist. He didn't just do the occupation, wasn't just engaged in that occupation that he originally lost employment in, but he was also a very, very good artist. And exploring this in counseling, he was encouraged to start looking at a partial career in art and see what he could do with it. He not only ended up on television because of some art he donated to a charitable organization in our community, but also has put together an artist's resume, has developed some really good feelings about himself and about what he can do in that area. And I think now this will be, at least in a part-time manner, part of what his employment is now. Those are the exciting kinds of things that this grant has really allowed us to do, as one example.
Fantastic. So will you be applying for funding again this year?
We have a lot of different initiatives that we'd like to consider. The United Way funding has been so helpful in building on what we've created in the past. We had previously created a network of professionals in the community, psychologists who are willing to see people on a low-cost or free basis in their offices, and they volunteer time in that way. United Way helped us with that. It's helped us with this program in really developing a universal screening for mental health issues that helps us connect people with the other agencies like Community Mental Health way ahead of time. We've done some trial programs at Safe Harbor and Goodwill this year to see how we can effectively embed into those organizations so that we can connect people with these community health care services. and the mental health services that are integrated with them. We'd like to really look at expanding our work at Safe Harbor and going from a pilot program to a fuller program of services. So that's certainly one initiative. And we want to build our volunteer base. We've added some wonderful volunteers this year, counselors who have supplemented the services we provide at the Traverse Health Clinic. The United Way grant has helped us to do that. So we want to look at that too. So we'd like to, definitely would like to add more funding and see where we can go from here.